what do you really need to do this? And I wanted to show you a little snapshot from my Amazon account here. This is a centrifuge that you can buy on Amazon. As you can see here, I purchased it two times already. The last time was in February 9th, 2021. And I've used this now we have it in 2 different clinics now here in Dallas. But this is just a cheapo, centrifuge. Like by cheapo, I mean it's a good quality centrifuge, but it's not a brand name. It's not, something that has special kits that come with it. It basically is just a simple centrifuge. But most importantly, it has 2 things. 1, you can control the time that it runs. And 2, you can control the rotations per minute. And that's all you need in a centrifuge to make most of these regenerative medical products. And the thing is to show you is that basically for $300, you can have a centrifuge. But to be real, like in order to basically do your own injection, like the actual cost of it, you need 1 centrifuge, which is $300. You can use it over and over, obviously. You need some blood tubes. And depending on what you're going to make, some of the blood tubes have anticoagulant, some of them don't. And we'll talk more about that. But basically for about, I think what it boils down to is for about $6 to $8, you can generate almost any regenerative medical product derived from blood in your office or in your clinic. And so it's pretty easy to do. And so I just wanted to show you the power that you guys have, because it's not hard to learn how to do this stuff. And, obviously there's a huge demand out there. People are always hurting. That's one thing great about pain management is there's a never ending demand of patients. And the thing is that you have the ability to heal them and help them. So what products can you actually make with a centrifuge? These are all the products that you can make with a centrifuge. You got PRP, PRFM, PRF, which we already talked about. And you have some other things that we're not going to talk about today, but realize they're out there because I want to show you just how many cool things you can make. So you have LPRP and APRP, which for lack of a better word, these are PRPs that stimulate an inflammatory response similar to prolotherapy. So, prolotherapy, the idea behind prolotherapy is like, hey, if there's an area of the body that is injured, what I'm going to do is I'm going to go in there and I'm going to cause inflammation, because I know that inflammation will cause the body to mount an immune response, and that immune response will heal the area. This is commonly done. It's done in aesthetics all the time, right? I mean, if you guys ever use old therapy, right, what are you guys doing with ultrasound, right? You use ultrasound to cause an injury, same thing with PRP, microneedling, et cetera. You cause an injury for the immune response to come in and basically heal that area, regenerate new tissue. The same thing occurs in orthopedics, same thing occurs in all the different areas of the body. You also have concentrated growth factors, which you can derive, which are very useful. You have PPP, which is platelet fluoroplasma. That's very useful for lubrication, et cetera, and still maintain some of the great proteins that are necessary. And then you have autologous serum, which is great for hydration and sometimes used in ocular cases. So a lot of times they'll use that for ocular wetting, et cetera, if necessary. So you can derive so much stuff just from a $300 centrifuge and the ability to draw someone's blood. And that's why I wanted to make sure you guys know this, because to me, this is like one of the coolest things that you can do to help people. And I think that what you'll find is that each of these products, they're like their own tool, in the same way that a sculptor might use different tools to achieve a different effect on their sculpture. You can use each of these products to achieve a different effect on your ability to heal tissue. Each of them have their advantages and disadvantages. Each of them are useful in different situations, but they're all useful depending on what's going on. However, we'll talk about these 3 because these are the top 3 that you'll probably use, these a little bit less often. So real quick, let's talk about platelet physiology. As you probably noticed, all these things have pretty much all the top 3 have platelet in them. And so what is it about platelets that make it so useful to heal people? Platelets release these essential growth factors when they're activated. So when platelets when you have like an injury, so you cut yourself and platelets start to stick to that injury, they release these growth factors that heavily promote tissue repair, angiogenesis, which is basically making new blood vessels, and collagen production. And they do that through these growth factors here. So everything from, without getting too much into detail, PDGF, VGGF, FGF, EGF, you name the acronym, it's out there, but realize that these little growth factors are the things that actually make the healing work. And then just to give you an idea, here's a picture of a platelet, and you can see all the things that are in a platelet. Noticed here the alpha granules, and you also have dense granules here. The alpha granules are kind of what we're after, because the alpha granules have all of these in here. And so the alpha granules in red here, these are all the growth factors that are inside a platelet. You can see how many of them there are, significantly large amounts. The dense granules are the granules that have the calcium in them, the epinephrine and histamine. These are typically used in wound healing. And they're part of like when you trigger a coagulation cascade, the dense granules actually kind of promote that coagulation cascade from to continue to scale and keep going on. The alpha granules are the ones that release the healing factors. So our goal in general is to get these growth factors here and basically using platelets, using the patient's own blood, take those platelets out and then stimulate those platelets to do a number of things so we can get those growth factors, put them on the area that's damaged and have that area healed, which is really cool. Here's just some more exactly what they do. I don't think it's important to memorize all of them. The big picture here is that number one, realize that many times the names of these growth factors, many times they were discovered and it thought they did only one thing. And then later they found out, oh, it does like 12 things. And so, for example, they can, like, here's one, vascular endothelial growth factor. You think, oh, well, it's for the vascular endothelial cells, right? Well, also it does migration and mitosis of endothelial cells. It increases permeability of vessels, stimulates chemotaxis of macrophages, et cetera. So realize that many times those growth factors can do multiple things. I wouldn't waste your time memorizing any of these. Just realize these are the things that are actually doing the work for us. One of the coolest things that can happen during a platelet coagulation is that it makes these little fibrin matrices. And what's really cool is the fibrin matrices are designed to kind of stop the bleeding. This is what eventually becomes like a scab, right? And it has this kind of effect where once it gets triggered, it causes the release of these dense granules, which then cause it to continue. So it's almost like a match starting a campfire. Like it takes a little bit of initiation, and then once it goes, it's self-perpetuating, and so it causes this huge effect. And what's really interesting is that having this scaffold from fibrin matrix scaffold, it actually causes the effect of the healing to be prolonged, but it also makes the healing more effective because you have cells like this here's macrophage floating around. And if it finds fibrin, it's able to actually connect to it. And it actually was able to what they call chemotaxis, which is basically using the cell can actually travel along these fibrin matrices to get to the areas that are damaged. It's really, really cool. So by having that, scaffold the fibrin matrix, it really allows for migration of fibroblasts, keratinocytes, and endothelial cells into wounds so they can start to heal.